Doreen Granpeesheh is the
Dr. Doreen is an expert in autism. Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Marianne wants to know, does hug therapy help with kids with ADD and ODD help regulate their emotions when they're frustrated and angry?
Oh, this is a tough one. So, hugging a child, there's something to be said for the sensory input that the child receives. But it is extremely dangerous when you hug a child who has, let's say, oppositional defiant disorder, ODD, because what you will be doing is very likely hugging them, which is usually classified as a reinforcer, when they do something bad. I mean, it's just that simple. So when an individual has any kind of challenging behavior, hugging them is probably not the right thing to do at that moment.
Because it will just increase them wanting to do that more often. They'll learn, oh, if I throw things, I get a hug, and I want a hug, so I'm going to throw things. And
Depending on whether or not the hug is pleasant for them.
Okay.
Exactly.
Got it.
So if the
An
child...
important point.
If the child... I mean, reinforcers in ABA are defined not as whether or not they're pleasant, but they're defined as whether or not they increase the behavior that just preceded them. Because something might be very reinforcing to me, like a hug, but might be aversive to you,
True.
Which is you don't like being hugged. So just be careful, because when you do anything that is reinforcing, you're going to increase the behavior. So if a child finds hugging pleasant, and they are challenging behavior like hitting, and you hug them, then the challenging behavior will increase. If they have, I don't know how ADHD would interact with hugging, but again, those are the principles that are important, is just making sure that you're not reinforcing certain behaviors. Now, on the other hand, separately, there are kids who are very sensory, I guess, fragile, or, they have a very hard time with contact, and gradually acclimating them to contact is helpful, because there will be a lot of things in their lives that they might be uncomfortable with. For instance, I've had children who... Okay, now as I keep talking, I think of other things to say. So I've had children who, for instance, would not even put long sleeves on because they don't like the sensory feel of that. So it's important to shape the child to the point where they are able to tolerate touch, right, or a loose hug. On the other hand, there are people who really incredibly calm down when you do give them pressure, as in a hug, which, talks about like Temple's squeeze machine.
Yes.
I have children who become incredibly calm after a period of having experienced some form of pressure. It just calms them, it sensory regulates them.
Yes.
So those are all the things to consider, and it is possible that if a child is extremely hyperactive, yes, then if you give them some level of pressure for a period of time, it's possible. Not always the case. It is possible that the child might downregulate a little bit.
But you would do that more as an antecedent than a consequence, right?
I would do it more, yes. I would do it more as on a schedule.
Yeah, they call it a sensory diet.
Exactly.
And they used to wrap Jem like a burrito and squish him, and then he would be more attentive during the next lesson.
Exactly.
He was more regulated. But it was
actually,
always before the fact, before he fell apart.
That's right. That's right. Very important.
All right. Where did I leave off? I had a really important question. Where did it go? Where did it go? No. It was right here.
I see one about...
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.